Hi, this is Dr. Chan with Crown Dentistry. We get a lot of questions about dental exams, so today we're going to answer some of the questions you might have about dental exams, and hopefully we can give you a better understanding of what dental exams are all about. So, just like it's really important to eat the right foods, get enough sleep, exercise, it's really important to also stay up on keeping your mouth, your teeth, everything in there, gums, your tongue, your cheek, clean and healthy. That's where dentists and dental hygienists come in. We're here to make sure that everything in your mouth is healthy and everything is working the way it's supposed to be working, and that your mouth doesn't have any diseases or infection. The way we do that is by making sure that you have regular cleanings and also giving you regular exams just to check and make sure that everything looks and feels and functions the way it's supposed to. So when we see our patients for a dental exam, we're looking at a couple of things. First, of course, we're looking at your teeth to make sure that they're healthy, there's no cavities, there's no cracks. If you have any fillings or crowns or restorations, if those are all functioning properly and not worn out or old or failing. We also look at the soft tissue in your mouth. We look at your tongues, your gum, your cheeks to make sure that there's no infection there and to make sure that everything is clean and healthy. So as we mentioned earlier, there's a couple of things that we're looking for. We want to make sure that your tissues, meaning everything that's part of your body, your teeth, your tongue, your cheeks, your gums, that everything is healthy and free from infection. If you have any fillings or crowns or implants, we want to make sure that everything looks the way it's supposed to, that there's no residual infection, and that everything is whole and working the way it's supposed to. We want to make sure that nothing is leaking or broken, and all of these things we check out while we're doing an exam. Sometimes we use x-rays to help us see what we can't see just on the surface, but mostly we're just taking a look with what we can see on the surface too. The best case scenario for you as a patient, of course, is to find that everything is healthy, everything is working the way it's supposed to, and there's nothing needed additionally on your part. Of course, sometimes that doesn't happen. Sometimes there's a cavity, or there's an infection, maybe a filling is broken, or a tooth is broken, in which case we can assess the situation and see if anything else is needed in order to bring everything into a healthy state. And if something needs to be fixed, then we can take some steps to make sure that we can do that for you. So if we're seeing you as a patient for the first time, usually we want to do a full complete exam. Those usually take anywhere from half an hour to an hour. A lot of times we're also going to want to take x-rays so we can see what's going on underneath the surface, make sure that your bone's healthy, make sure the insides of the teeth are healthy, and then, of course, we're going to look in your mouth and see if your teeth and all the other soft tissues, such as your tongue, your gums, your cheeks, are also healthy. We also might take some pictures just so that we can record how everything looks at the date of the exam, and also so that we can show you so that you know what's going on in your own mouth. So most of what we're doing for dental exams is pretty comfortable. Sometimes when we're trying to take pictures or x-rays, it can be a little uncomfortable if we have to put it all the way back in your mouth, but we try to go as quick as we can, and there are things that we can do sometimes to make things more comfortable, such as numbing gel or topical analgesics so that you don't feel the x-ray sensors, for example. So the best way to schedule an exam with our office is to give us a call. Our phone number is 916-285-9678, or you can go onto your website and make an appointment there.